Hi, this is Dr. David Green with PreferredPainCenter.com, where we bring you anything and everything with education for pain management. Today, the topic of discussion is intra-articular injections for knee arthritis. So, 30 million people in the United States have osteoarthritis, and the knee is one of the most commonly affected joints. So, a knee replacement is usually a very effective procedure, but it is a last resort. And the first resort is anti-inflammatory medications, Tylenol by mouth, then you have physical therapy and things like that. But in the middle, what has worked really well over the last few decades is injections into an arthritic knee. And the most commonly injected substance is a corticosteroid. And that might be Kenalog or another one of the types of steroid medication, but it tends to work really well, because there is an inflammatory component to osteoarthritis, which is the wear and tear version of arthritis. And the steroid is a huge anti-inflammatory, so it can knock out some of that for a few months and provide pain relief, okay? It's not clear if steroid has deleterious effects on the cartilage. It does in animals, that's been shown. So, you know, there's that to weigh as a risk versus a benefit, but they've been shown to be extremely beneficial. The newest type of injection into an arthritic knee is called hyaluronic acid. Now, if you're wondering how to spell that, it's in the description of the video, but I'll just call it an HA injection, okay? And HA is a substance that is normally found in the knee anyway. It's like the motor oil lubricant of a knee. And the HA injection helps to replace that. It can also help promote the need to make more of it and provide pain relief. Now, it's not from another human. It's actually made from rooster combs, which is strange how they found it to be in that, but it's a very good source of it. So, and it comes in different manufacturers and different dosing. So you have one called Synvisc, you have one called Hyalgan, and it's usually the orthopedic doctor's or the pain doctor's preference as to what's going to be injected. And some of these need to be injected one time, some are injected 3 to 5 times over a series of weeks. And when they've looked at research comparing the different formulations against each other, they've pretty much been shown to be equivalent. And that's the way the FDA has sort of looked at it to approve them. And so they tend to work really well, especially if you're a younger individual. If you have a post-traumatic issue, like you have you're a basketball player and you have a knee defect in the cartilage from an injury or a car accident, or mountain biking, or a motorcycle accident. You know, all these types of things can cause cartilage problems and what's called post-traumatic arthritis, not just from wear and tear. So HA injections can work really well for those, and they can be repeated every 6 to 12 months, okay? And they work really well. I think the study that was initially done showed 65% good to excellent results after 1 year. And that's not bad at all, you know, for a low risk. The risks of a HA injection are there's a low risk of infection. It's like 1 in 20,000 or something. There's a risk of pseudo-infection, which means the knee looks like it's infected, but it's really not. That happens once in a while. And once in a while, it can also flare up gout or one of those types of problems in a patient that has gout or a crystalline arthropathy. But overall, they work really well. There's some new studies coming out showing that steroid injections alternated with the HA injections in a person's knee have extra beneficial effects. There's one that looked at ketorolac, which is a non-steroidal medication that can be injected, versus HA, and then looking at them together, you know, alternating them. That actually worked really well too. So the pain doctors at Arizona Pain are board certified and fellowship trained. They do work with osteoarthritis of the knee. There's also physical rehabilitation programs, chiropractors, acupuncture, which has been shown to be extremely beneficial for knee arthritis. And they can use those in combination to help you hopefully avoid surgery. So there you have it, an overview of injections into the arthritis of the knee. I'm Dr. David Green with PreferredPainCenter.com. Oh, and very quickly, call 602-507-6550 to make your appointment with Arizona Pain. They serve the whole valley, multiple locations. Once again, I'm Dr. David Green with PreferredPainCenter.com. Your pain stops here.